I'm going to be discussing working at a nursing facility versus a clinical setting. And I'm going to give my opinion on what I think is best for you to work at straight out of nursing school. So first, let me explain what a nursing facility is. So a nursing facility can sometimes range from having one side rehab, one side long-term care. The long-term care is the residents that will be there for the remainder of their life to their end of life. The rehab side is they're there to get rehab, and they're there for a short amount of time. The rehab side can be any type of resident, from a stroke resident, hip replacement, broken leg, heart attack, just different little diagnosis while they're there. So I just want to explain to you what that was. So for me, when I first got out of nursing school, I started at a skilled nursing center. The one that I worked at, one side was rehab and one side was long-term care. I actually worked on the long-term care for a little while, but then I moved over to the short-term. So let me just let you guys know. So when you work at a skilled nursing center, it's way more work. I was passing medications to about 30 plus patients. I worked the morning shift, meaning I worked from 7 a.m. to 3:30. So I had to give morning medication as well as new medication, and checked blood sugars morning and afternoon. Okay, so in that facility, it made me a strong nurse, because you need to be able to assess patients, you need to be able to learn signs and symptoms, you need to be able to learn about your medication, you need to be able to educate the patients, you need to be able to motivate the patients, you need to be able to motivate your staff, because the nursing attendants are under you, so they come to you for help. So you need to really know all of this. I feel like working at a nursing facility, it helps you become a well-rounded nurse. It helps you to be able to move fast, work on your toes, learn medication. For me, I think now, whatever any interview that I go on, I feel like I get the job, only because right now I'm more confident, and I'm more confident in what I can do, what I can bring to the table. So let me give you an example of learning things. So when you first get out of nursing school, if you know about medication, you know all the laws, which is blood pressure medication, say atenolol, metoprolol. You know that you have to hold the blood pressure medication if the patient blood pressure. In my facility, it depends on what facility you work at. My facility, if their blood pressure was under 110, we have to hold the blood pressure medication, or if their pulse was under 60. So systolic, hold the blood pressure if their systolic is under 110, and hold it if their pulse is under 60. So say for instance, if you're straight out of nursing school and you encounter this, say for instance somebody's blood pressure is 156/78 and their pulse is 52. You're going to be like, oh my God, I'm going to hold their blood pressure medication. Say for instance their blood pressure medication that you had at that time to give them was metoprolol as well as hydralazine. You're going to be nervous and say, oh my God, I have to hold their blood pressure medication. I don't want their heart rate to drop. If you know medication and you're learning, and this is where I'm saying you learn medication, signs and symptoms, side effects. Hydralazine, you will hold me learning. I know to hold the metoprolol. I will hold that one, and I will give hydralazine, because hydralazine, it lowers the blood pressure, but it increases the heart rate. So I would give that. As well as, say for instance, if a patient is on insulin, and you check and you know that they're on long-acting insulin as well as fast-acting insulin. Say for instance they're taking Lantus as long-acting and they're taking Humalog as fast-acting. Say for instance they have a insulin. Say for instance you have to give them 20 units, and then say for instance with the Humalog, sometimes they have a sliding scale, sometimes they just have set units that they give, standard units that they give. Say for instance they say you have to give them 10 units of the Humalog. Say for instance you notice that every time you're giving this medication, their blood sugar is dropping. It's just you feel like, because you go and recheck it and you see that by lunchtime it's super low, like it's under 100, like really low. And you're like, oh my God. If you see that you keep on encountering these things, you need to let the doctor know, like, look, doctor, I monitored this patient's blood sugar for this X amount of time, and you notice that you recommend that he lowers their dosage of their fast acting insulin into a sliding scale. You can keep the long acting, but just suggest that they change the standing units to a sliding scale. That's it. You there to help out the patient. You there to learn these different things, because you are the person that's taking care of these patients. So the patient's best interest is in your hands. You learn how to do care plans, documentation, SBARs, incident reports. Like, you'll say, for instance, if a patient, you notice that a patient used to always eat all the time, now the patient is not eating, so you feel like the patient is declining because they're not eating. You're going to recommend to the doctor, you have to do an incident, you have to do an SBAR for this. You have to do an SBAR, and then you have to come up with a care plan, and you have to come up with a goal in a certain amount of time that you want to reach that goal. So you can suggest that in this amount of time, and say, for instance, you can suggest in 2 weeks you revisit and monitor, reevaluate it in 2 weeks, or you can either give it a month goal, whatever you want to do. You can say that you're going to make sure that you add a nutritional drink to the patient's breakfast, lunch, and dinner. It's like different little things that you can do to be able to help the patients. Maybe, say, for instance, you can have the patient go in a dining area and eat with everybody else, so they can be on so they can have people monitor their food intake or help encourage them. It's different little things that you can do that you will learn by working in a nursing facility. But it is hard work. It's not easy work. You're not going to you're going to be having all kind of stuff that happen. Patients falling. You have to be able to make sure that your CNAs are turning the patients. If you feel, you have to encourage the patients to be able to get better, eat, get up out of bed. It's all kind of stuff that you have to do. So I feel like working in a nursing facility, it makes you an efficient and effective nurse, unless you just don't want to be a nurse and you really don't care. Then some nurses are just in it for the money. They're not really in it because they care. So those nurses, you are going to see how their patients are doing. You can tell. So let's go to working at a clinical setting. So right now I work at a clinical setting. The company that I work for is a big company. They do not allow the LVNs to work inside the hospital, so we can only work in their clinical settings, which is like a specialty department, urgent care, or internal medicine. So I've worked in urgent care and internal medicine, and I also work in a specialty department right now, as well as doing urgent care as overtime hours. So working in a clinical setting, so much easier. You do not have all the responsibility. You're limited to what you can do. You are not assessing patients. You are not monitoring. You're not doing that much hard work. If you see that's a problem, you're going to escalate it to the RN, and that's what you do. So at a clinical setting, let's just speak on internal medicine as well as urgent care. So you're going to be processing patients, meaning bringing the patients in, checking their blood pressure, weight, all their vital signs, and you can be proactive as well, and also checking their medications that they're taking, if they're smoke, if they don't, things of that nature. So you can be proactive, which means, let me give you an example. Say, for instance, a patient walks into urgent care. She's of childbearing age. She's complaining of abdominal pain as well as back pain. For you to be proactive, you'll make sure that before you place her in a room with the doctor, you do a dipstick on her as well as a pregnancy test. A dipstick is when you get a sample of their urine. You dip the stick in there, and it checks them for nitrates, ketones, leukocytes, protein, different things like that. So it checks them. Basically, it checks them for all those things: UTI, different things like that. and a pregnancy test. And say for instance a male comes in and he's suffering, a male or female, either or, they come in and say for instance they said for the past couple of days they've been thirsty, sweating, peeing a lot, all this, super hungry. Of course you're going to do a dipstick on them and check their blood sugar, because maybe they may have, their ketones may be high, maybe they may have high blood, they might be suffering from hyperglycemia. So it's like that means high blood sugar. So yeah, so working in a nursing facility, it'll make you overall efficient and effective nurse. Working at a clinical site is a cool experience as well. It's a lot more easier. So it just depends on what you're looking for. So I'm so glad that you watched my video. Please give it a thumbs up if you really enjoyed the video. If you want to see more videos from me, or if it's specific things that you want to see, just comment below. Let me know. If you have any questions, just let me know. Thank you so much for watching my video. Peace out.